Good evening everyone. Today's our topic is on maxillary artery. Now, I am Dr. Jesslyn, Assistant Professor from the Department of Anatomy. So, I will be taking you in details about maxillary artery. Okay, let's start with it. Now, this is the competency under which you will be studying the maxillary artery. It says describe and demonstrate the extent, boundaries and contents of temporal and infratemporal fossa. So, the maxillary artery, the topic for today is basically the content of infratemporal fossae. Okay. Now, these are the learning objectives under which you will be studying today. First of all, you should know the location of the artery, the extent, the course, the branches and definitely the applied aspect of that particular artery. Let's start. First of all, in a nutshell, what is infratemporal fossa? Now, infratemporal fossa is basically a gap present just below the zygomatic arch. Okay. Now, it is just present behind the maxilla, in front of the stellate process, just lateral to the pterygoid plate and medial to the ramus of the mandible. That is how you get the infratemporal fossa. Now, in the infratemporal fossa, you have lots of contents are present, which include the muscles of mastication, that is the masseter, temporalis, medial pterygoid, lateral pterygoid. Let's not go into detail about that. Coming to the blood vessel, which is the main topic today, we have the maxillary artery. Along with that, you also have the maxillary vein and pterygoid venous plexus. It is also accompanied by some of the major nerves of this region, that is mandibular nerve, its branches, chorda tympani nerve and aortic ganglion. Let's come in detail to the maxillary artery. This is how maxillary artery looks like. Now, maxillary artery, as you can see in this figure, it is a major artery in the infratemporal region. So, when you do the dissection of this part, the major artery which pops out in front of you is the maxillary artery. Its beginning, it starts from the terminal branch of external carotid artery within the parotid gland at the neck of the mandible. So, this is the beginning or the origin of the maxillary artery. This is how you have to explain the beginning of it. Then it runs horizontally, where it is divided by a muscle of mastication, that is lateral pterygoid. So, hence the lateral pterygoid muscle will divide the maxillary artery into first, second and third part. Okay. The first part, as you can see in the figure, it runs horizontally forwards to reach the lower border of the lateral pterygoid muscle. That is the first part. Then after that, the artery runs superficial to the lateral pterygoid muscle to form the second part. After that, from the inner border of the lateral pterygoid muscle, the artery moves deep into the pterygopalatine fossa through the pterygomaxillary fissure. Okay. Now, these are the three parts of the maxillary artery. These are the branches, as you can see. The first part include, just make a note of these arteries, then it will be easy for you. In the first part, you have 5 branches: deep auricular, anterior tympanic, middle meningeal artery, accessory meningeal artery and finally inferior alveolar artery. Okay. Second part, you basically have the muscular branches, which include deep temporal artery, pterygoid artery, buccal branch and the masseteric branch. Third part, 6 branches are there, which include posterior superior alveolar artery, secondly infraorbital artery, greater palatine artery, pharyngeal artery, artery to the pterygoid canal and finally sphenopalatine. Now, don't get worried seeing all these branches all together. You have specific mnemonic for each of these parts. Now, as you can see, I have highlighted the initial letters of each artery. Like in first part, the mnemonic with which you can remember is DAMAI. DAMAI. With that, you can remember or memorize the name of the branches of first part. Second part is basically, first of all, it's the muscular branches. So, just think about the muscles you get in this infratemporal region. If not, come with DPMD. You have the 2 ways to remember it. And in the third part, you have the mnemonic PIG pass. So, using this PIG pass, you can recollect the branch's name. Okay. Now, Have a look at this figure. First artery is a deep auricular artery. Now the deep auricular artery, as the name says, it will supply the region of the auricular part, the ear. Then you have the anterior tympanic artery. Anterior tympanic artery reaches towards the tympanic region to supply the tympanic membrane and the tympanic structures present near to it. Third, you have the middle meningeal artery. Now, middle meningeal artery is very important because it enters the middle cranial fossa through a foramen. Which foramen? The foramen spinosum. Fourth artery is the accessory middle meningeal artery. Again, this artery too enters the middle cranial fossa through the foramen called as foramen ovale. So, these two arteries are very important because these two foramens are also very important. Then the last artery, that is inferior alveolar artery. Now, inferior alveolar artery is also called as Dental's artery. Why? Because it passes through the mandibular foramen present in the ramus of the mandible. It runs through the foramen, reaches the mandibular canal to finally divide into incisive branches and mental branches. Clear? That was about the first part. Coming to the second part, as you can see, the second part is lying just horizontal to the muscle lateral pterygoid. You have deep temporal artery, two branches of deep temporal artery. You have a buccal artery, mesenteric artery and pterygoid branches. It's just simple because it is supplying the adjacent muscle of the similar name. Coming to the last part, which has 6 branches. First of all, you have posterior superior alveolar artery. This is basically supplying the superior gum present in the posterior part. Then the infraorbital artery passes through the infraorbital foramen present just below the orbit. Greater palatine artery passes through the greater palatine canal or the greater palatine foramen present in the palate. Pharyngeal artery is an artery present near to the pharynx. Finally, you have an artery of the pterygoid canal which is passing through the pterygoid canal present between the pterygoid plates. Last, you have the sphenopalatine artery. The sphenopalatine artery, as you can see in this figure, this is the continuation of maxillary artery. You can also say the sphenopalatine artery is the terminating point of maxillary artery. Okay. This sphenopalatine artery will reach the anteroinferior part of the nasal septum to form a plexus called as Kesselbach's plexus or Little's area. It is a common site for nasal bleeding. Okay. That's what I just now mentioned. Sphenopalatine artery, it's the continuation of the maxillary artery or the termination. You can, one or the other way you can say. It enters the nasal cavity through the sphenopalatine foramen and reaches the anteroinferior part to give rise to two branches, the two terminal branches. Posterior lateral nasal branch and posterior septal branch. This is how the maxillary artery got terminated. Clear? Talking about the applied aspect, the anterior division of middle meningeal artery is present in a H-shaped sutural area called as pterion. Pterion is present in the norma lateralis. So most commonly during the time of accidents, road traffic accident, this region gets ruptured, this region gets fractured. If the pterion gets fractured, the artery lying below it, that is the anterior division of middle meningeal artery, is likely to get ruptured, which leads to the formation of extradural hemorrhage. If it impinges on the brain, it can lead to lots of neurological deficit. So soon the blood has to be evacuated out. Okay, so the knowledge of the middle meningeal artery is very important. First, this was the first applied aspect. Second, as I have already mentioned, you all know sphenopalatine artery is the terminating point of maxillary artery. Where is it present? It is present in the anteroinferior part of the nasal septum. So children have a common habit of pricking the nose. So when they prick, basically they are irritating this plexus. So it's very common for bleeding to occur. clear? And also any surgeries pertaining to this region can also hamper the blood supply provided to this region, that is the sphenopalatine artery is ruptured. Okay. Now this is in a nutshell what we studied just now. Maxillary artery, it is an artery present in the infratemporal fossa which is divided by a muscle called as lateral pterygoid muscle. It is the terminal branch of external carotid artery runs through the parotid gland to continue as the sphenopalatine artery. It finally terminates as the sphenopalatine artery. That was about the beginning and the termination. Coming to the branches, we already know the first part, we memorized it using DEMI, that is deep auricular artery, yes, anterior tympanic, middle meningeal, accessory meningeal, and finally the inferior alveolar. Second part, it's our muscular branches, that is mesenteric, the two deep temporal arteries, buccal and pterygoid branches. Finally, in the third part, you have PIC-PAS to remember. Posterior superior alveolar, infraorbital, greater palatine, pharyngeal artery, artery to pterygoid canal, and finally the terminating branch, sphenopalatine. Now, I hope the topic was clear to you. Is there any doubts? If so, you can ask question. If there are no doubts, then thank you for listening.